Dean, great to have you with us. Let's talk a little bit about the next step in this Heart Hub. So now, well, we had a when, and that's already been established, and there are other whens to come. But now we have a where. Tell us about the where.
Sure thing. So our plan was always to make sure that we were invested in our partners and our community. And the thing that we knew going into the plan when we did the proposal was that we need to be someplace that's already acceptable. We need it to be a place that needs operating dollars in order to expand services. So Salvation Army was a natural choice for us. They're a great partner. They have good facilities, and it just made a lot of sense. You couldn't build a brand new hub in the timeline that the proposal was set for. So for our community and our partners, that was always the plan.
Dean, when we picture the Heart Hub, I think we get caught up picturing, a big hub and it's a new building and it has this, and we're trying to get our minds around what this actually looks like. To hear it going into an existing place like the Salvation Army, can you help to describe whether there's anything that we will physically see or whether this is simply services that are now offered?
Yeah, so it's interesting when you look at the Salvation Army Center of Hope. You drive by, you see this big building. There's a lot more to that facility than it appears. And over the years, it simply hasn't had the operating dollars attached to certain parts of the facility to make it run. So they do actually have some space that is going to work for us. We're doing a little bit of investment up front to make sure that those spaces work. So we'll have a staffing sort of clinical space that is a wraparound space, as well as the actual beds for the hub are within that facility. So it, out, I guess to answer your question, from the outside, it's not going to look any different. But from the inside, there is a distinct physical pathway to the space that we'll be using, as well as a connection to the other services that are already in the building.
And in terms of staffing a Heart Hub, does this mean that the Canadian Mental Health Association Thames Valley needs to bring on new staff members? Is this something that can be done with what you have existing right now?
Yeah, there'd be a flurry of postings that'll happen associated with the Heart Hub, as both for us and our partners, because it's in partnership that we're making this hub work. For CMHA, yes, we will be posting for new positions. We have some existing resources that we can attach to the Heart Hub, which includes leadership. We're also posting for leadership, but we have a core group of leadership that is associated with the Heart Hub.
Okay, we're talking with Dean Astolfi from the Canadian Mental Health Association Thames Valley. We're talking about the location of the newest Heart Hub that was announced as one of, 18 that were announced, 27 overall in the province by the provincial government. It will be at the Salvation Army. And now we look to see what this does for our community. And Dean, maybe you can take us through that. Who is this going to help and how?
Yeah, it's most important to focus on the name and what the initiative is in the first place, right? It's to focus on people that are homeless, struggling with addictions and mental health issues, and they want recovery. So that's who we'll be serving. It'll make a definite impact and dent in the community, along with our partnered services, to really help out those that are going to benefit from this particular program. This particular program isn't going to serve every single person that's homeless in our community, but it's certainly going to make a positive impact.
One of the things that was brought up by London Mayor Josh Morgan when he was in studio with us a couple of weeks ago was when we look around our streets, we will still see people who are struggling. We will still see people who are living homeless. But what we don't see is those who have been helped. Is that something that maybe we need to think about more? We need to focus on more, that we are seeing some of the issues that we have being addressed, but because we still have people who are in difficult situations, we're still going to think, oh, it's just the same old, same old.
Yeah, I would agree with that. I mean, the successes that we achieve aren't readily seen when you have demand, right? There's this constant demand. And some of those issues are bigger than a Heart Hub, right? We have a housing crisis. We have socioeconomic things that are going on outside of the Heart Hub that affects how people come homeless in the first place, right? So there's a lot more to it. But I think you're absolutely right that we need to do a better job of saying what our success is, how many people we've helped out. And the nice thing about the Heart Hubs in the proposal that went through, and from our funders' perspective, they really want us to measure that. They want us to show that, what impact have you actually had? How many people are you actually helping out? And so we'll certainly be on top of that as we open and as we start helping people out.
I guess as a final question, we're talking with Dean Astolfi from the Canadian Mental Health Association, Thames Valley. As a final note, the idea that we need more spaces for mental health, are we seeing that addressed in any way, or are we still seeing, okay, it's too bad we don't have psych hospitals or something like that, areas like that, locations like that?
Yeah, I think it is getting addressed. I mean, we're community-based mental health services, right? So we look a little bit different than a hospital does or some other services that exist. And I do think that key to this particular proposal is that we need operating dollars to do the things we need to do. And that's why we pursued the funding that was available to us. And that's why we are where we're at. The other thing that goes on at the same time is there's initiatives where we're building more supportive housing. CMHA intends to expand our units that are available, because without movement, without addressing the non-market, we call it supportive housing, you're not going to have the success you need with the hubs, because you have to have this flow, you have to have this movement. So down the pipeline, you have to have some place for these folks to go that come through for hubs. And we have a lot of that in place, but we need to continue to expand that. Back to my original point about demand. That demand isn't going away anytime soon. So we got to keep on expanding supportive housing on the non-market end.
Dean, thank you so much for taking some time for us today.
I really appreciate it. Thank you.